Hi, everyone. Welcome to Gateway Center of Excellence in Rural Health's 29th virtual lecture, a part of our virtual lecture series. This will be our last lecture of the year. It's kind of hard to believe with the weather outside. Doesn't feel like it's almost Christmas yet. My name is Amy, and I am a research assistant here at Gateway CERH. Just before we start, I would like to acknowledge the land that we operate and reside on. So Gateway CERH's office stands on the traditional territories of the Anishinaabe, Haudenosaunee, and Neutral peoples, and is connected to the Dish with One Spoon Wampum, under which multiple nations agreed to care for the land and its resources with the Great Lakes in peace. Sorry, I just got a notification I needed to delete. We also acknowledge the Upper Canada treaties signed to this land, which include Treaty 29 and Treaty number 45.5. We recognize First Peoples' continued stewardship of the land and the water, as well as the historical and ongoing injustices that they currently face in Canada. We accept responsibility as a public institution and as a treaty people to renew the relationships with First Nation, Métis, and Inuit people through reconciliation, community service, and respect. So Gateway CERH is a rural health research organization with the mission to improve the well-being and health of our rural residents through research, education, and communication. We are located in Goderich, Ontario, and to our knowledge, we are the only rural health research center in Canada governed by community-based volunteers. Our topic for today's lecture is substance use in rural landscapes, navigating challenges and cultivating solutions. This lecture discusses the realities of substance use, addiction, and homelessness within rural communities. Our lecturer for today is Katie Sparling. Katie wears very many hats. She is currently obtaining her Master's of Social Work from the University of Windsor. She just finished her placement component actually at our Gateway CERH office as a research assistant, and she is an opiate counselor within the Canadian Mental Health Association, otherwise known as CMHA. Katie also works at Optimum Place in Stratford, supporting women and children fleeing domestic violence. Her work seeks to support those struggling with addiction, mental health, and instability within our rural communities. Our presenters and panelists are also from CMHA and are well-versed in the challenges that arise in working with remote communities and with a lack of resources. So joining her are the following panelists: Melissa Bowen, Supervisor of Specialized Programs; Arletta Hallahan, Adult Substance Use Counselor; and Jaden Mitchell, Team Lead for the Heart to Home program in Goderich, Ontario. To thank those that are ongoing attendees, we give diplomas at the end of each semester to those with perfect attendance to recognize your commitment to and involvement with this education series. And then once the lecturer is done presenting, we invite participants to chat down below in our Q&A box and ask questions to our panelists, where both the panelists and the lecturer will answer those questions. A brief disclaimer before we start: the views expressed in this lecture may not necessarily reflect Gateway CERH's views or opinions, but we believe in providing a platform for a range of perspectives and thoughtful discussion. Another brief disclaimer that I feel is worth mentioning for today's lecture is the new crisis line just got released last week. So if you or someone you know is in immediate mental health crisis or has suicide-related concerns, 988 is the new number that you can call or text 24/7. It is toll-free and available in French and English. And that is a new crisis line for you or anyone that you know that may need mental health supports. We will have a slide at the end of this lecture with more information and supports as well that will stay up if anyone wants to jot it down or need that later. That is all from me. So I will pass it off to Katie now to start doing the lecture.
All right, so I am just going to get started here. Full disclosure, I'm in the office today, so if you hear a bit of background noise, I do apologize. We're just kind of getting moved over right now. But again, thank you, Amy, so much for the warm introduction. And like she had mentioned, we do have all four of us today from CMHA. So like I said, it's myself, Jaden Mitchell, Melissa Bowen, and Arletta Hallahan, and we will go over kind of what we do and our roles within CMHA. So today I'm going to talk a little bit about us at CMHA, what we do, some of the programs and services that we offer, some of the local realities and trends that we're noticing in Huron County, how you would potentially make a referral, and then conclusions, questions, and discussion. So anyone's encouraged to put any questions they have in the chat box. box, and we will do our best to answer those. There is also some pre-generated questions that we will be answering. And if at any time you have any questions, feel free to let us know. We are also welcome to, you're welcome to stay on after or send us an email after. So there'll be some information on how to do that as well. So first I'm going to go over our goal, vision, mission, and values. So I do have kind of two screens here, so I'm not avoiding you guys, just looking away to read off some of my notes. So CMHA, or Canadian Mental Health Association here in Perth, Addiction and Mental Health Services, also known as CMHA, and we will refer to it as CMHA for convenience throughout the presentation, is a steadfast commitment to enhancing mental health and well-being for clients that we serve. CMHA here in Perth is a beacon of support, understanding, and client-driven support and advocacy. Our dynamic organization stands at the forefront of mental health initiatives, offering a range of programs and services tailored to the unique needs of our rural community. Being that we are in a rural community, we've really had to gear our services to the direct remoteness of our community, which we will discuss in the presentation. So we offer counseling and support services, education and awareness campaigns, and CMHA is dedicated to breaking down the stigma and fostering a more compassionate and inclusive environment for the clients that we serve. The efforts of CMHA staff extend not only to mental health, but addiction supports, where we play a crucial role in assisting individuals facing varying substance dependencies. Through counseling and case management, coordination of care, collaboration with various healthcare providers, CMHA here in Perth is the guide to individuals on paths to recovery and support. So what sets CMHA here in Perth apart is not only their commitment to individuals' well-being, but our tireless advocacy through systemic change. By working collaboratively with other agencies and engaging in community education, such as this presentation today, other presentations that we commit to in the community, and connecting with our community partners, we aim to create a mental health landscape that prioritizes understanding, empathy, and free accessible supports. In essence, CMHA here in Perth is not only an organization, but a lifeline for those navigating the complexities of mental health and addiction. So with that being said, I'm not going to read off all of the specific programs that we have. As you can see, we have several, and we are constantly changing, growing, and evolving the programs that we do have. So the ones that we will highlight today based on the staff that we currently have here is myself. I'm an opiate case manager counselor. We have Jaden, who is our heart to home team lead. So she will discuss some of the great work that they're doing there. And then we have Melissa Bowen, who is our supervisor of specialized programs. And Melissa, formerly prior to taking on that position, was one of our nurses at our community withdrawal clinic. And then we have Arletta Hallahan, who is our adult substance use counselor, focusing on the northern end of the county, as well as our main office in Goderich. And Arletta is still doing some pregnancy and parenting work as well. If at any time you have any specific questions about any of the programs that we haven't discussed, you are welcome to ask those at any point as well. So our story. So for most of you, there may be a little bit of confusion as we just did an amalgamation. So previous to January 2023, there was Choices for Change, which specifically focused on addictions. And then there was Resilience Mental Health that's focused on mental health. Our community really saw the need to come together and bring mental health and addictions under one roof, making it easier for the clients to connect with us. And so that services were more streamlined, that we run under one roof. And so there's no wrong door. So if someone's calling into our agency, they get streamlined accordingly. And just for some context, here in county, the population is just over 60,000. In Perth County, population is 86,000. And in the last year, CMHA has supported over 3,000 people. And that includes all of our different programs. So for context, that's about 1 in 15 people that we're supporting through our agency. So pretty significant. So some local realities, obviously, times have been challenging for all. And we really just wanted to highlight some of the things that our community is experiencing. So we've seen an uptake in intake since the amalgamation. Folks are finding it easier to access one system for service with the support of an intake. And just for some context, if someone is calling not necessarily aware of what they're needing, they're absolutely able to ask some questions to our intake team. And our team will absolutely support with how we can navigate which service makes the most sense for you. So sometimes we have loved one call-ins in saying, I'm not exactly sure what to do with my partner or my child, and how can I help them? And we're absolutely happy to help those folks as well. We've seen a significant increase in amphetamine and opiate use. And unfortunately, in 2021, so that's our most recent stat that we have, there was 32 reported overdoses. So that's potentially to the hospital or EMS. Of those 32, 8 of those were fatal overdoses. So we are working diligently with our community partners to ensure that those numbers are falling instead of rising. So as a result of that, all of our staff now are carrying naloxone with them, as we are predominantly out in the community. And then we've also increased our harm reduction supplies and service sites. So instead of just having it available in our predominant main offices in Goderich and Stratford, we've tried to branch that out into the community, and some more staff are carrying that as well.
Katie, sorry, I don't want to interrupt you, but your slides I don't think are changing. I don't see them changing on my end. I'm not sure.
Okay.
Yeah, and I think
Melissa, are you seeing them change? No. Okay. So is there a different way to do that then, Carissa?
maybe just try and reshare, and I'll let you know if they change this time.
Okay, so let's go back to. Okay, are you seeing them change now?
I'm seeing you open them.
Okay. Okay.
Yep, that's perfect.
Okay, perfect. Sorry about that. Thank you for letting me know.
No worries.
I'm gonna move you guys down here now. Okay, so that's where I was. Sorry about that. So again, as I continue, so some of the local realities. So our drop-in centers, which we've added a new one in Wingham, but between our drop-in centers in Goderich, Stratford, and Wingham, we've actually almost doubled our numbers from last year in comparison to this year. So we've seen a huge uptake in folks accessing those services. We've also seen an increase in suicide and suicidal ideations. So more clients coming to us with concerns around suicide, whether that be for themselves or loved ones or people they know in the community. And as well, another reality is with housing rates on the rise, that's also increased our rental costs. So for our clients who are potentially in the market rent, we're finding that they are barely getting by or not getting by. So just a little plug for CMHA as well. If you are a landlord or you know someone who is a landlord and you have units available and you're wanting to partner with us, any one of us would be happy to have that conversation with you and can give you some more information about how to do so. So those are just kind of some of the things that we talk about. Another piece of that is around the misconception that homelessness and addiction isn't happening in our community. I would say when I started with CMHA almost 5 years ago, that there was a lot of conversations of, do we really have homeless folks living in Huron County? We don't hear that as commonly anymore, but I think the reality is that it's very prevalent within our community, and we're finding it's becoming more of a challenge to support the clients with the lack of resources available. So some of the things that CMHA offers, so we offer counseling and support services. So again, CMHA branches offer counseling and support services, including individual counseling and group therapy. So again, this may be one-to-one counseling, it may be coupled therapy, or it may be group therapy to address various aspects of addictions and mental health. We offer education and awareness. So again, we want to work towards raising awareness about addiction, reduce stigma, and provide education to the community. This may involve workshops, training sessions, and information campaigns, or very similarly to what we're doing today. And then we offer advocacy. So CMHA may engage in advocacy efforts to promote policies and practices that support individuals with addictions and mental health challenges. This can involve advocating for increased funding for treatment programs, harm reduction initiatives, improved access to mental health services. So we're constantly trying to advocate for ourselves and our clients to say that the need is there and growing, and we can't unfortunately do less with more. So we're really pushing to make sure that we have the supports we need to support the clients. And then we also offer harm reduction supply. So CMHA has implemented harm reduction strategies, and we work from a harm reduction framework to minimize the negative consequences of addiction. This could include providing resources such as needle exchange program, education on safer substance use, and the supplies. In a perfect world, we would look at safe consumption sites. This is something that I actually had the privilege to talk to a professor about who had more experience with safe consumption. But unfortunately, it's just not something that seemingly is feasible in our community right now. So then myself, so I'm going to give you kind of a quick rendition of what I do, because as most of my coworkers know, CMHA, all of our work kind of every day is different. We don't have a typical office job. We're often out in the community. So for myself, I usually start with an assessment with the clients, conducting a comprehensive kind of overview of what they're needing and why they've come to access services and supports, and really understand their specific challenges that they're encountering. Then we talk about treatment planning, and treatment planning can look very different for every client. So some is potentially to maintain their use, but create a safer space to use. Some are looking to withdraw from substances. Some are looking to prevent relapse or overdose. And then I work on coordination of care. So again, the reality of our work is that many hands makes light work. And that is absolutely true with mental health and addiction, that the more supports that we can have and bring into place, the better it's going to be. So a lot of my time is spent connecting with community partners such as Ontario Works, the hospital, other social workers, treatment facilities, anything we kind of have available to us to make sure that the clients receive the best support possible. And then advocacy. Oftentimes we are really encouraged to advocate for our clients and making sure that they receive similar or the same care as others do in their community. And this can include assisting with treatment, social services, and support programs. As we know, the realities in our rural community, wait lists are long and access to some services can take quite some time. So we really have to be quite creative when we're exploring advocacy. And then another role for myself is around education. So providing information around opiate use, treatment options, and available resources. So that could be, again, directly to the client who is impacted by opiate use. That could be family members, friends, or community partners so that they are aware of some of the challenges that someone using opiates may experience. And then monitoring and support. So for myself, and luckily with CMHA, we don't necessarily have a very strict timeline of how and when we can support clients. Oftentimes clients come and say, am I going to be done with the service after 10 sessions? We have the flexibility to support clients longer term to make sure that their treatment goals are met. And then crisis intervention. So again, for many of us, as we know, the reality of the work is it's not always Monday to Friday, 9 to 5. There's a lot of crisis that comes into that, and how we support our clients in making sure that they are seeking some type of stability. And like I said, community collaboration. And, last but not least, definitely our least favorite part of the role, but the reality is that we are required by our colleges to create in-depth documentation so that we actually have kind of a roadmap for the clients and for ourselves of what the outcome of the sessions has been. And we have to make sure we keep those things up to date. And so that can be something to look back to for the clients. It's also a place to keep our documentation safe and secured, and ensures we are meeting and maintaining our standards of confidentiality for clients. So with that being said, I'm now going to pass it over to Melissa.
Great, thank you, Katie. As Katie and both Amy mentioned, I am the supervisor of special programs at CMHA. Up until actually a couple months ago, I was actually a registered nurse with the community withdrawal management team. This team is now one of the programs in which I supervise, in addition to the peer support team and the court support team. Today, we're going to take a closer look at the community withdrawal management team. When at full complement, our team consists of a nurse practitioner, who is Jeff Wheatley, 5 registered nurses, 2 opiate case managers, one of which is Katie, and a medical administrator. Our team runs 5 clinics out of 4 different locations throughout Huron and Perth counties. This past year, we've opened two new nurse practitioner-led clinics. One is located in Exeter and one in Listowel. Our nurse practitioner runs these clinics along with the support staff, and the team works collaboratively to provide a variety of services related to withdrawal management from a variety of substances within the community. Alcohol withdrawal supports, opioid replacement therapy, in-home withdrawal supports, nicotine replacement therapy are all some of the services that we assist clients with. As Katie mentioned, opiate use has really become quite problematic in our community. As such, it tends to be a focus point within our clinics. We use opioid agonist therapy, or OAT, such as methadone, Suboxone, Sublocade, to help those who are struggling with their opioid use. Although OAT is predominant within our clinics, we also support clients who wish to withdraw from other substances, alcohol, benzodiazepine, amphetamines, you name it. We'll try and see what we can do to help those clients. In addition to the nurse practitioner clinics, we also work in collaboration with Dr. Dadema and the Here Firth Clinic to provide withdrawal support. These clinics are located in Goderich, and then we have 2 in Stratford. And the main focus of them is really the opioid use and the alcohol use disorders. Another thing to mention with respect to all 5 clinics is that we also have peer support available. So if clients are looking to speak with someone with lived experience, then they can do that at our clinics. In addition to the clinics, we support individuals in the community who would like to complete a withdrawal from home. Providing it's safe to do so, we can help with the withdrawal from any substances, including opiates, methamphetamine, benzodiazepine, and alcohol. As you know, or you may or may not know, withdrawal from substances like alcohol or benzodiazepines can be really dangerous or even life-threatening. So our team can complete assessments to determine if at-home withdrawal is safe, or if the individual will need to go to a center where they can be closely monitored. If it is determined that an in-home withdrawal can be completed, we'll work closely with the client to create a safety plan to help them reach their goals. In addition to these services, we provide some smoking cessation support. We work with CMHA's STOP program to provide nicotine replacement therapy, so patches, gums, inhalers, lozenges, to assist clients in quitting smoking, along with providing some support and advice in how to go about doing that. All of the services within the community withdrawal support program are very client focused. We really certainly do our best to try and meet the clients where they're at. We really want them to be in the driver's seat, and we're there really to help them navigate and provide direction as needed.
Great. Is that it for you, Melissa?
That is it.
Okay. So now we are on to Jaden.
So I'm the team lead for the Heart to Home program. We provide intensive case management and housing stability and support services to those who are chronically homeless and have high acuity as defined by the VI-SPDAT, and also people who are vicariously housed. We do have a new shelter model that's running this year. Before, some of you may be aware, some of you may not, we were running out of North Street, United Church, and we were just open from 7 p.m. to 8 a.m. Clients could come in, get a warm meal, and they would sleep in the gymnasium. However, this year we are trying a new model, and that is here in Goderich. It is run out of a motel, and we can support 14 individuals, so 1 less than last year when we were supporting 14. Our team, when it's at full complement, we're a team of 8 plus myself. I look over the day-to-day operations of motel and trying to meet the basic needs of our folks. I do carry a caseload of our more high acuity people and working with them and meet them where they're at for their housing journey. A big role that our team plays is collaboration with other community services. So we are funded by Huron County, so I do connect with them monthly and we report on what we're seeing within the community. We work with the Huron Women's Shelter, OPP and MCERT are involved, victim services, hospital, the ACT team, and we connect with the connection centers in Clinton and Wingham. Right now, from our by name list that is held through county, We are currently seeing about 100 individuals within county who are experiencing homelessness. As you'll see on the screen, 43 individuals have been housed in 2023, which is a very big victory for our team. 22 participants in 2020, 2021, and 47 in 2022, 2023, which are all great numbers. However, there are still 100 folks that are vicariously housed or homeless. So we are doing the work every day to meet the basic needs and get them. Document ready is a really big one that we focus on. Housing searches, getting financial supports. And then once they are housed, our team will continue to support to about 6 to 12 months on stability, where we're focusing on budgeting, being a good neighbor, your connection with your landlord, kind of getting them stable before slowly either connecting to other supports or just removing supports. We do work collaboratively with a lot of our different programs within CMHA. So we also collaborate internally as well. And that's it.
Thank you, Jaden. Yeah, I don't think we can say enough good things about Jaden and the work she does with the Heart to Home team. She's really been so crucial in making sure that our folks are supported. And again, just a little plug to say thank you to Jaden for all of her hard work. All right. Next up, we have Arletta.
Thank you, Katie. So the adult program offers voluntary services to individuals who are concerned about their substance use. So we provide service throughout the county. Our workers will meet at medical centers, unemployment office, locations throughout the county. So for intake purposes, people are asked to call intake, and they will arrange a meet and greet, either in person at our office in Goderich or Stratford, or in other parts of the community. We also do virtual or by phone. So we provide education, awareness. We also meet with families who are concerned about loved ones with addiction issues. We do a lot of advocacy, assessments. If people are interested in going to residential programs, we will complete the intake. Yeah, so that's us.
Perfect. Thank you, Art. All right. So I do want to just touch briefly on some of the successes we've talked about. I know Jaden mentioned this, but again, I think it's really important to highlight that just in 2023 alone, there's been over 40 residents housed in Huron County. So those folks potentially were chronically homeless, so actually out on the street or in encampments, potentially sleeping rough, so sleeping or couch surfing. So again, they were of no fixed address. In our small community, that's a pretty significant number. And again, like I had said earlier, with the lack of affordable and safe housing, that number is really incredible. So then, like Melissa had mentioned, we've also increased our clinic capacity. So our goal really is to spread across the county and make sure that we have services available throughout the county and not just in our, like I said, our main office in Goderich and our main office in Stratford. So we've opened a new opiate or community withdrawal clinic for opiate dependencies in Exeter and in Listowel. And Jeff really has been such an integral part in having clients met and supporting some of their day-to-day medical things, if medical procedures and things like that, if they don't have a doctor. With that being said, too, part of the role of our clinics is to make sure that if someone is seeking additional resources, they absolutely can have those needs met. So that's where myself, there's a nurse there, either the doctor or Jeff. And then we also have our peer support as well coming to those clinics, which has been great. And we do support with additional things. And Jeff has actually made a great partnership with one of the local hospitals to be able to have our clients have psych assessments done, which has been great. We have increased our staffing. So again, not all of our programs are at full complement. So again, another little plug for CMHA that if you or you know someone who may be well suited to work with us, absolutely let us know. Melissa would be happy to answer those questions as she is the supervisor. But yeah, allowing more programs and more staff has allowed for additional supports. Like I said, we've just recently opened our Connection Center in Wingham, which is staffed daily from Monday to Friday, and has allowed for additional resources to come in. So clients have a meeting space and can access other community partners as well, not just ourselves. We've been able and fortunate enough to bring peer support into Huron County. So working with someone who has lived experience with addictions and or mental health, and really being able to provide some context to clients that differs from some folks who don't necessarily have that skill set. And that's really opened up the doors for clients to receive services in a different way. And then we've also increased our office space. So again, we have made more capacity for in-person services. So for most days when you go to our offices, there is someone there that can meet and greet you in person. And so again, that's been a big shift since COVID, where we didn't have the capacity to do that. We are absolutely finding people are utilizing that service as well. And then our referral process. So again, referrals can be done many different ways. It can be a self-referral. It can come from another social service provider. Family referrals are welcome. So again, if someone is calling in and they're looking for services for themselves or in regards to a family member, unfortunately, if the client is an adult, we do need to specifically speak to them because we want to make sure that our services are client-centered. We often get concerned loved ones or parents who may be calling in, and we really want to make sure that the client who is the one who's accessing the services is doing it for themselves. So support, the email through support, if you wanted to send a referral there, we have an application for service online, or you can call into our office and be directed to an intake worker as well. So then just again, a few other crisis resources that we wanted to talk about. So again, like Amy had mentioned, we have the new 988, not a specific affiliation through CMHA, but absolutely a resource that everyone should be familiar with. So it's specifically a suicide hotline. So one specifically in Huron County. So we have the Huron Perth Crisis Line, which we often refer clients to after hours. So if we are not available, that is often our first point of contact for clients if they are not available, or a CMHA staff is not available. We have the non-emergent police line, the Huron Women's Shelter, which they also have a 24-hour, 7-day-a-week crisis line that is manned. And then Huron County Victim Services for those who have potentially been a victim of a crime or other things. Victim Services has been a great resource in the community. And then we have 211, so that can be a phone call. So if you're looking for more information and resources that are local to you, or potentially, let's say London or further out that you're not as familiar with. And Connects Ontario, I think every one of us who's talked today has utilized Connects Ontario, whether it be their phone line or their website, just to get more information specifically on healthcare related resources within our community, or ones we're not as familiar with. So with that being said, that comes to the conclusion of our presentation. Amy, just remind me again kind of what our next step is here.
Yeah, so we will switch now to the Q&A. Katie, are you able to see the Q&A?
Yes. So do you want me to stop sharing my screen or leave it?
You can stop if you'd like, just to make it more of a conversation here. Yeah, perfect.
Okay, so now we're going to go to the question. So I will try and go in order here. So what is the research on the value of safe injection sites for users of drugs in terms of survival, harm reduction, and rehabilitation? So I can speak to this a little bit about the conversation, again, because we don't have one in Huron County. There's multiple approaches and opinions of a safe injection site. One that they've actually implemented in London, the injection site has a test tool on site where someone could come in and actually test their substance so that they know what they are using. So for example, we've had clients in the past who believe that they're using amphetamines and it's potentially been laced with something else such as fentanyl. And so as far as what we see for the value, or what I'm speaking from myself, is making sure that the clients know what they are ingesting and that they have knowledge about their use. Because the reality is for some clients, they don't know what they're using, or they have a rough guess and they're hopeful. And obviously that creates a lot of risk. All right. So another question around, oh, sorry, my questions are getting all over the place. Another question around the urban myth of homelessness people and or immigrants are being put on a bus and dropped in communities such as here in Perth. So Jaden, I think you're already unmuted. I love that.
No, I get asked this often. So we do a screening when we are doing an intake that the client has to be from Huron County. A way that we check this is through their financial supports. Usually OW or ODSP will be the first people we call to confirm if they are from Huron County. The next is most of the time we're already connected to the individual, to our services in some way. So it definitely is a myth. There is no bus coming to Goderich, dropping off other members of a different community. We do our best to try and do some background information and gathering. And if we are unable to confirm, then we kind of pause until we can make sure that they do have some connection to the community. I think the stigma around that is also because they're becoming more visible, and we can get into that conversation about why, and that's due to the housing crisis. So people who have been couch surfing, that maybe has broke down, and we're seeing them in the community more. So we believe they're not from here, but they are.
Yeah, and I can speak to that a little bit too. Similarly, I also work in Perth County for another agency, and often, unfortunately, because our communities are being inundated with folks, some of the times that there is policies in place to ensure that they receive services based on their address. So we oftentimes, if they have come from another community, we try and encourage them to receive supports and services in their community so we're not further displacing them. So how does CMHA, or what does CMHA do to support clients after hours? So we do have 1 day a week where we work in our Goderich and Stratford office until 8 p.m. So we have services available. The after hours component is hard because we are doing so much kind of throughout the day. Oftentimes we are referring folks to the crisis line, and depending on the nature of the need, if it's something more so than that, if it's potentially like they're in a dangerous situation, we would always encourage our folks to be calling police. But Melissa, correct me if I'm wrong here, we are working towards hopefully having services available longer and longer durations throughout the day. But again, we're trying to kind of work towards staffing our current needs first, and then making sure we can sustain those programs before we expand that after hour services. Okay, so how often are addictions multiple in the same person? So for example, alcohol and opiates, tobacco, and potentially amphetamines. Melissa, do you want to take that one?
Sure. I mean, I was just reading that question and thinking of the answer there. So I think it is common, right? Like that's it's definitely not uncommon for folks to have a multiple polysubstance use is what we call that. And really most of the time, clients have a drug of choice, and that's generally what's the most problematic for them. And so we're all versed in assisting clients in polysubstance use, or just one substance, but it does happen often. Yeah.
Okay, thank you. Another question, so I'll direct this one to Jaden. Is Heart to Home the same program as Here and Out of the Cold?
Yes, so the shelter model that we run from April to November is called Huron Out of the Cold, and the team that supports that program is called Heart to Home, but we work the whole year. So from November 1st this year until the end of April, we are in our motel model. So we support individuals who are accessing the emergency shelter at motel, and then also carry a caseload throughout the whole year of people who are chronically or vicariously housed.
Thank you. Jaden, the next one's going to come to you as well. So it's asking about potentially seeing someone who is presumed homeless in a bank lobby, and how can the public help, or what should we do to get these folks help?
I guess that's the assumption there, that they haven't asked for help or that they want help. Some folks aren't ready always, and they're on their own journey. But if you are seeing someone in a bank vestibule, we do run a drop-in center here on Kingston Street, 11 to 2 daily. We do have a shelter phone number that is available online if you are, and if they're willing to do an intake to get on our wait list for a motel, or calling crisis. The Here on Perth crisis is really great with connecting with folks and seeing how they can help support them. I think it's just always asking them, are you okay? Do you need anything? Do you need to make a phone call? Anything like that. But sometimes they might not want to engage in services. So it's just being mindful of that. It is their choice in the end.
Thanks, Jaden. So the next question is specifically about CMHA's peer support program. So again, I can do my best to speak to this, and maybe Melissa, this is something you can speak to. So CMHA has developed a really great and ongoing peer support program in Stratford. So we've had a lot of success in our Stratford and area, where we have a peer drop-in center that's run and open every day and run by peer support workers. So again, it's a communal space that is utilized by clients. Who they have recreational activities. There's always snacks available. And again, it's a really informal space where they can connect in ways that they need. And then as far as their training, I believe most of our peer support staff are trained by the Canadian Peer Support Training Certificate. I maybe have misread that name, but essentially they have all completed that training, which is, again, I'll let Melissa take this one from that perspective, but yeah, all of our peer support have been a great addition to our resources, and the clients are really appreciative of having someone who, quote unquote, has experienced it firsthand. And we often get told that we like someone who has knowledge that doesn't necessarily come from a book, but comes from the heart.
Yes. Yeah. Thanks, Katie. Yeah. Our volunteer, peer support workers have various levels of education, but they all do certainly have some sort of training to get them to where they're at, in addition to their lived experience. And really the lived experience is really the core of what they're doing. And it's so tremendous in being able to help our clients. As Katie had said, we do have a very strong peer support team based out of Stratford, and we have recently, within the last few months, hired one peer support worker for Huron County, and we're in the midst of hiring another. So we're hoping to sort of transfer what Stratford has really accomplished and transfer that over to Huron County, in hopes to build those relationships and provide that support for our clients.
Great, thanks, Melissa. Next question is specifically about a connection center in Clinton. I'm not familiar with anything that's specifically coming to Clinton. I don't know if anyone else on the call.
There is a drop-in center that's opened in Banastra that is funded by the United Way. Connection centers, for the most part, are funded by United Way, and CMHA here on Perth sometimes contributes to that or staffs the connection center. So that's how we're working with them. But as of right now, there is not one in Clinton, but hopefully they pop up more in the rural community as they're needed.
And Jaden, just for interest sake, if you don't mind, can you just share where the location of the connection center or drop-in center is in Banastra, just so folks are aware?
Yeah, I would have to pull up the actual address, but it is, I believe, running out of one of the churches there. And but I can get that and put that in.
Perfect, thank you. Next question is about getting nicotine replacement therapy. So there's multiple different ways to do this within our community. That can be done through a family doctor. It can be done through the health unit, or ourselves. So again, depending on the service. So typically we try and offer that service to someone who is already a part of our program, and would be encouraged to access the health unit if they weren't necessarily a part of our program. But it's not something that we would necessarily deny anyone from the public who is interested. Asking about obstacles of having safe consumption sites and drug checking services. One of the main obstacles, and I think is the most common, is it's an expensive service to have. So again, it would require a space. There's always a lot of pushback from community partners to have a safe consumption site in their community. Most folks like the idea of it. However, it's a bit different. Folks feel differently when it's in their backyard or in close to schools or close to community centers. And the expense of a actual drug screening service or a checkpoint. I believe Mike was telling me that they are upwards of $100,000 for a screening kit. And again, that has to be supported with staff on site as well. Okay. Sorry, the questions keep coming in and then I get bumped down to the bottom here. So as service providers, how do you inform community members of your services and encourage them to engage with your services? So very similar to presentations like this, we are often out in the community, and all of us on this call and most of us who work at CMHA are always happy to answer any questions. We do community presentations. We try our best to be in community spaces such as hospitals, such as medical centers, and so that if anyone were to have questions, whether that be another service provider or someone accessing the medical center. So for example, today I'm at the Exeter Medical Center, and if anyone had questions about the services that we were offering, whether they were coming in to see their family doctor or coming in or working here, I'm happy to answer those questions and make sure that they're connected to the appropriate resources. Okay, where did we go here? Can each of you or a couple of you describe a successful client interaction that has left a lasting impression? Jaden?
Yeah, I can think of an individual that was very visible in our community that was experiencing homelessness for roughly about 6 years. So he was accessing shelter for the last 6 years. Again, people knew him by name. He was involved in some ways, very interactive with the community. However, the question was always, why is he not housed? Why aren't you housing him? However, he wasn't ready. He refused to do documentation readiness, so getting IDs. He refused to do his taxes. And without those two things, you cannot be housed. When you're filling out an application, you need to have IDs and you need your notice of assessment from your taxes a lot of the time. So he just wasn't ready to do that. However, this summer, something clicked. He said he no longer wanted to be living rough. He didn't want to be in shelter again this year. So he worked with me and we got him document ready over the summer. We completed taxes from like 2007. It was a long time, but he agreed and consented to all of it. And then he is now housed in Exeter, which is huge. Which makes me want to continue to do the work. Those small wins are something that our team really, really holds on to. And so him having access to his own space, his own bed, his own shower every day, and just having those basic needs met, that'll be like a success that I'll carry with me for the rest of my career, really. So that's a big one for me. Art, Melissa.
I can share one. However, the one that I'm thinking of, the one that just keeps popping into my mind, I actually was not part of the agency when he started, but apparently he was quite sick with opioid use disorder, and he he came to our clinic, got on Suboxone, and then Sublocade, really turned his life around. He left us, I don't know, just with successful with, I believe I'm not sure he's married, but with a long-term partner, a child, and living a full-time job, just living life to his fullest. Like it was, yeah, fantastic. There's a number of them. There's a number of clients like that that are really succeeding in our programs. That's fantastic.
Art, did you want to jump in?
Well, I can say like we've all had those successful stories, and I think when we think of the clients that have been successful, it's because we've worked really well as a team, and there's been lots of support from, you know, the programs at our agency. Yeah, so I think we're a really good team and we work really well together.
And I would really piggyback of what Jaden said. I think sometimes what's wins for us might not be considered a big win, but even if someone has consecutively met all of their appointments, you know, for 2 or 3 weeks, we take those as wins, because sometimes our work is very challenging and we really have to hold on to the moments that are positive. And again, having someone connect with us in a meaningful way, because a lot of our folks are not always excited about joining our services, or they're really reluctant about joining our services, or have a mistrust of social services. So we really try and implement ways to create a safe environment for our clients and meet them really where they are at. I think all of us on the call today have quite literally met people in the most random of places, have had car appointments, have had walking appointments, have met, you know, wherever we can utilize space that feels safe and comfortable for the client. So really making sure that we're going to them and providing that resource as best as possible. So I think we have just a few more questions here. I'm going to try and get to all of them, but I also recognize that we are running out of time. So there's a question around engaging with volunteers. So yes, we do have volunteers within the agency. I believe actually right now we are seeking volunteer drivers for our programs. And in order to do that, anyone could call into our office and request information about that. And they're encouraged to do so if they have capacity or know someone who's interested. And we can absolutely make sure they're connected to the appropriate managers or supervisor to get connected around volunteering. Okay, one more question. So question specifically around what we would recommend for folks if they are on the wait list for the Here and Out of the Cold program, and what we would do in the interim when they're on the wait list.
Yeah, so that is a great time for folks to still come in and work with us at our drop-in center, because we can still prepare them to do housing searches, or sometimes you need a birth certificate to get any photo ID in Ontario. And sometimes that can be a really big task for our clients. If to fill one out, you have to know a lot about your parents, which sometimes is difficult to remember, for them to know. Some of them are estranged. So we need to really start getting them document ready, which starts with the birth certificate, and then photo ID, getting taxes done. So there's a lot of moving pieces that we could be working on before them going into motel, or they can still be focusing on goals and not be at motel. Motel is temporary. Motel is not home. Motel, we don't want to be using a motel model. We want housing, stable, safe housing for folks. Motel is, I'm glad it provides safety and warmth, but I want people housed. So if they can come in and meet us at the office and do housing goals and housing searches, we can work with them, and hopefully they would get housed before having to access motel. And then other services, through hospital, there's the transition beds where they can hold people. Their timelines kind of differ, but up to 7 days. If a person is in crisis and really needs to get out of the inclement weather, I would suggest that they access those beds, or making sure that they're connected some way on ODSP or OW to possibly use some of their shelter funds to access motel, and not through our program, but still through their own funds.
Perfect. Thanks, Jaden. Okay, so I think we will bring Amy back in to just finish this off. But again, thank you to all who asked the questions. And if anyone has any extra questions that they don't feel comfortable asking this in this space, feel free to reach out to any one of us and we'll happily answer those for you.
Perfect. Thank you, guys. So I'm going to just do some concluding statements. We hope that this has provided some educational and insightful information that you can take home tonight about substance use, mental health, and homelessness within our community. I for sure definitely learned a lot, and I very much enjoyed this lecture. So through this lecture series, Gateway CERH strives to better the health and well-being of rural residents through research, communication, and education by providing a range of topics relevant to rural communities. So a huge thank you to our lecturer, Katie, and also her panelists, Art, Melissa, and Jaden. Thank you so much for joining us today and speaking on these issues. It definitely is a prevalent topic within our community, especially going into the new season. I would also like to thank our sponsors for the continued support. Without them, the lecture series would not be possible. So this list includes Microwave Basics Goderich, McGee Motors Goderich, Libro Credit Union, Lighthouse Money Management Goderich, McEwen and Fagan Insurance Brokers Goderich, Huron Telecommunications Cooperative Limited, so Huron-Tel, Zares Goderich, CIBC Wealth Management, and the Goderich Royal Canadian Legion Branch 109. Gateway CERH is a non-for-profit organization with charitable status, and we greatly appreciate and welcome donations or any support that we do receive. If you would like to donate to Gateway CERH to continue the support of this lecture series and all of our other health projects that we have going on, I do encourage you to visit our website at www.gatewayruralhealth.ca/donate. You can follow us on Instagram, LinkedIn, X, formerly known as Twitter. You can like us on Facebook or subscribe to us on YouTube. If you are on YouTube, you can hit that notification bell and you will be notified every single time that we do upload a video. Or you can sign up on our website and receive email notifications and newsletters that way. Our next lecture is in the new year. It is on Tuesday, January 9th, 2024, with Mike Beasley, who is discussing substance use in primary and community care. So he'll address opioid use disorder treatments, update us on the cannabis legalization, and how psychedelics are becoming more widely used as prescription drugs. We hope to see you there. And of course, as always, stay safe. The holidays can be a bit of a difficult time for some people, so just be compassionate to others and especially yourself during this time. And from Gateway and everyone here, we wish you a happy holidays and a happy new year. Thanks so much for joining us. Bye, everyone.